Hi, my name is Teresa. I am a registered nurse at the Willis Knighton Eye Surgery Center. Today, I am here to go over your home care instructions and your eye drop chart. It is normal to have redness, blurry vision, and a scratchy sensation after surgery. We recommend a warm compress placed upon your eye for the scratchiness, which is just a clean, warm washcloth laid upon the eye, and you can use that as many times as you need to. If you experience discomfort, you can take Advil or Tylenol every 3 to 4 hours as needed. If the compresses and the Advil and Tylenol do not help your discomfort, you need to call the office and let them know. You may resume your regular diet and your home medication. On the day of surgery, it is important to have someone with you because you have had sedation. Be careful bending and stooping for the first week in order to prevent falls. While resting, you should wear your eye shield that came in your eye kit for the first 5 nights. Do not rub your eye vigorously. If you should become constipated, you can take milk of magnesia that will help you and prevent you from straining. You may bathe, shower, and shampoo the next day after surgery, but do not let the soapy water run into your eye. Do not wear eyeliner or mascara for the first week after surgery. You receive some Solar Shield sunglasses. You need to wear these when you go out in the sunlight. If you are a hunter, we do not want you to hunt for 1 week after surgery. Do not lift over 10 pounds for the first week following surgery. Most people can resume their normal activity in 2 to 3 days following surgery. However, be careful with strenuous activities and heavy lifting for the first week following surgery. If you have any questions or concerns, you can call the offices. The number's on the back of your home care instruction sheet. Before you begin your drops, make sure you wash your hands. If a loved one is helping you, make sure they wash their hands. Gently agitate the drops and begin. Your first drop will be Vigamox, antibiotic. Second drop, prednisone, steroid. Third drop, Prolenza, anti-inflammatory. Each box represents 1 drop. Vigamox 4 times a day. We recommend breakfast, lunch, dinner, bedtime. Prednisone 4 times a day. We recommend breakfast, lunch, dinner, bedtime. And Prolenza once a day. When you go down to the 2nd week, you'll notice the Vigamox is no longer on the schedule. That will be discarded. The prednisone will go down to 3 times a day on the 2nd week. It will go down to 2 times a day on the 3rd week and 1 time a day on the 4th week. Prolenza is an anti-inflammatory, and you will use that once a day for the whole 4 weeks. If you have any questions about your eye drops or your home care, feel free to call the office at any time.